It is the first day of fall and we're about to hit some peak flu season. So Dr. Cynthia Snider, Cone Health Infection Prevention Medical Director, is with us. And of course, the big question is, all right, when is the best time to get your flu shot?
We feel that right now is a fantastic time. Probably we'd like to have people get their vaccines in before the end of October.
Okay, so that's kind of like the best buy date before the end of October is what we should be reaching for.
Yeah, I know it's difficult to predict when the start of the flu season comes, but it is best to be prepared, I would say. And I'm a fan of not only just getting the flu vaccine, but also the COVID and RSV vaccine if you are at those age ranges. And those will all help with preventing pneumonia.
All right, so the question is always, who are the people that should be getting the flu shot?
So, it is approved for everybody, over 6 months. We have flu vaccines that are targeted for those who are older than 65, right? So folks who are older than 65 can get the high dose vaccines, but really we recommend it for a lot of folks, right? Patients who have any like heart disease, lung disease, so like diabetes or obesity, and also people who are immunocompromised. It's also beneficial for pregnant women because there is some considered also to be at risk for complications. And what the flu vaccine does not only helps decrease severity, but folks who are high risk of complications, it could actually reduce hospitalizations.
Okay, so, there's a lot of people out there who think, the flu is just another cold, another virus. Why is getting a flu shot so important?
So it's not just like another respiratory virus. I feel like, when you talk to somebody that's had the flu, they really do realize how severe it is. That it feels like you kind of got hit by a bus. It lays you out. You miss work. You can spread it to your family members. And it is associated with, folks, especially if you have an underlying health issue, it can cause worsening process. It's not unusual for us to see patients who are hospitalized with flu who have a mild heart attack with it. So or worsening respiratory underlying issues. So the fact that there are vaccines that prevent those complications that are safe to give, we really recommend folks to take them.
Mm-hmm. For people who are worried about the potential side effects of the flu shot, you hear all kinds of things. What should you tell them, or what would you want them to know about the possible side effects?
Right. So the flu vaccine is inactivated, right? It doesn't mean you're actually getting flu to get sick. And a lot of my patients mention, well, I feel so sick after I get the vaccine. And that's kind of your response of your immune system. Obviously, I think a lot of people get a soreness in their arm, from the injection site, and they can feel like they're under the weather that first 24, 36 hours. They might even get a low-grade fever, but that's just your immune system reacting to the vaccine and creating those antibodies to fight off once you get exposed in the future.
Mm-hmm. And so, you mentioned people feeling bad. What about kids? Because are the side effects a little different in children, and what should parents, caregivers know about that?
Yeah, I think with children, they can also have those symptoms of definitely of having the fever that day after, but usually I think it's fairly well tolerated. And the other thing to mention is that, last year we had a very significant flu season. We had many more deaths associated, a lot more hospitalization than the years prior. And so, that prompted for the reformulation of the vaccine so that it matches a little bit more of what's been circulating. So we're really hoping that the vaccine is more effective this year than it was last year.
Okay. We're going to get a little bit more into that, like how the vaccine is done and all of that kind of stuff. We're going to take a quick break, but we'll be right back in just a few minutes.